Good day. My name is Dr. Tatiana Nikolaevna Prokopyeva, and today we will discuss about pathology anatomy. In last time we discussed about acute inflammation and chronic inflammation too. Today we will discuss about compensatory and adaptive process in human body. Pay attention, it is not full information for this topic. It is only essential of knowledge about compensatory and adaptive processes. Let's go.
Такие как граждан.
Я.
Информационные технологии обеспечивают.
Начинаем очередную лекцию.
Compensatory and adaptive processes. Adaptive reaction are the provide adaptation of the organism to the environment, and several of the species develop in course of phylogenesis and ontogenesis. Compensatory reaction are the reactions that occur in response to the damaging factors and aimed at the compensation of disturbed function during this life. At the first, you must know what means homeostasis. Homeostasis, it is the constancy of internal environment required for the life of organism. Such relative stability of the biological system should be maintained both due to the external environmental change and internal change. All systems won't be continued in time. That's why there won't be stability. At some point, it will be moved to stabilization by adaptive or compensatory reaction. I hope you understand that and will be remember that. Okay, next slide. The difference between adaptive and compensatory reaction. Compensatory reaction in all time is about individual specificity. If we say about adaptive, it's a special specificity. Compensatory reaction is only pathological. Adaptive may be physiological and pathological both. Morphologically, compensatory reaction is present compensatory hypertrophy, hyperplasia. Adaptive reaction, it's about atrophy, hypertrophy, hyperplasia, organization, metaplasia, and dysplasia. Next slide about atrophy. Atrophy is a lifetime reduction of size, volume of tissue or cells accompanied by a decrease or loss of their function. Hypertrophy. Hypertrophy is an increased size of the organ or tissue due to the increased size of each cell. Hyperplasia. Hyperplasia is an increased size of the organs or tissue due to the increased number of cells. Organization. Organization is a replacement of the non-vital tissue by the connective tissue. Also, there are three stages of compensatory process on the term. First stage is formation. It's a mobilization of iron reserve in organs or tissue to compensate the increased load on the organ without structural adjustments. Second stage is fixing. It's a restriction of the organs or tissue under the influence of the increased load on the organ tissue, ensuring their excessive function. Third stage is decompensation. It's a development of the degenerative process in the organs and tissues that lead to decompensation. The main cause of the degeneration it is inadequate blood flow and is an consequent metabolic disorders. That next is about atrophy. Atrophy is a decrease of the volume of tissue or organ due to the reduced size of each cell, followed by the reduced number of cells accompanied by decrease or loss of the function. Atrophy is accompanied by a decrease of the organ's size. The face tends to become nodular, consistency become hard due to the increasing of connective tissue. Atrophies are physiological and pathological. Pathological atrophy, in turn, may be local and general. Physiological atrophy occurs throughout a person's life. The leading role in the development of atrophy belongs to apoptosis. For example, atrophy of the umbilical arteries occurs normally after birth. Also, atrophy of the thumbs and gonads can be seen due to a gene process. Senile atrophy is a kind of physiological atrophy too. It is characterized by the reduce the number of cells. The greatest value of this process is in the tissue consists for non-dividing stable cells, such as a brain and heart. Local pathological atrophy. Local pathological atrophy, atrophy from inactivity, disuse atrophy. It happens as a result of reduced the function activity of the body. It occurs due to the limb immobilization in the treatment of fracture in the skeletal muscles and bones. Initially, there is a marked decrease in cell size which can quickly restore its volume when resumed activity. There is reduction in both the size and number of muscle fibers during prolonged dysfunction. Local pathological atrophy caused by insufficient blood supply is associated with tissue or organ ischemia leading to hypoxia. As a result, there is reduction of cell volume and amount. For example, atherosclerosis of the coronary arteries leads to diffuse cardiosclerosis with degeneration of cardiomyocytes. Sclerosis is where an etiology of renal vessels leads to atrophy of the renal parenchyma and renal scarring, nephrosclerosis. Next is atrophy due to the pressure. Due to the pressure, compression of the tissue leads to disruption of microvasculation and ischemia. Atrophy of the kidney due to the damaging outflow of urine, hydronephrosis. Atrophy of the brain due to the damaged outflow of cerebral tissue atrophy, hydrocephalus. Next, local pathological atrophy. It's atrophy due to the degenerative neuropathic atrophy. Issue of the function of the motor neurons, such as polio of neurons, leads to atrophy of muscles group innervated by the nerve. Next, atrophy under the influence of physical and chemical factors, such as ionization radiation, atrophy of bone marrow and gonads, iodine, thyroid gland atrophy, etc. Next, local pathological atrophy is atrophy due to lack of hormone. For example, tumors or inflammation of the ovaries with decreased estrogen level leads to atrophy of the endometrium, breast and vaginal epithelial tissue. Hypofunction of adenohypophysis leads to atrophy of thyroid glands, adrenal glands and gonads. General pathological atrophy, it's more about cachexia. Hypertrophy. Hypertrophy is an increase of the size of organ or tissue due to the increased size of each cells. There are three main forms of hypertrophy: walking hypertrophy, vicarious hypertrophy, and hormonal hypertrophy. Walking compensatory hypertrophy is the most common type of hypertrophy that occurs in physiological condition and in certain pathological condition. Most often it develops in tissue consisting of stable cells. The main reason is reinforced load of the organs or tissue, cardiac hypertrophy, or skeletal muscles hypertrophy can be seen in people engaged in heavy physical labor at athletes. Walking hypertrophy is a hypertrophy of active function organs. In clinical practice, the most important is the cardiac hypertrophy. Cardiac hypertrophy etiology. There are two main groups of cause of cardiac hypertrophy. One of them intracardiac causes and extracardiac causes. Intracardiac causes are associated with the pathology of the heart, mainly heart disease. Extracardiac causes are associated with the pathology of the lesser or greater circulation, mainly hypertension syndrome of the lesser of greater circulation. Morphogenesis. There are two main major mechanisms of cardiac hypertrophy: increased intraventricular pressure, hypertension in lesser or greater circulation, stenosis of the valve, and next is elevated blood filling of the ventricle. The well influence with regulation of blood. Both mechanisms are accompanied by the reflex with increase of the heart contraction. To work hard, the inflow of the arterial blood reflexively increased, which leads to increased level of metabolic process. And if these factors act for a long time, it creates a precondition for the development of cardiac hypertrophy. Increased volume and mass. The normal heart weight is about 250 grams. In case of hypertrophy, it can be up to 1 kilogram. Beef heart or cor bovinum. The thickness of the heart wall increases. Thickness of the left ventricle should be not more than 1.5 centimeters, and the right ventricle 0.3 centimeters. But in hypertrophy, the thickness can reach over 3 centimeters. Also, thickness of the ventricle, septal, trabecular, and papillary muscles increase too. The cavities of the heart in the stage of compensation are narrowed, connective, tonaging hypertrophy, and in the compensation stage, extended, eccentric, myogenic hypertrophy. The myocardium is flabby and clay-like, fatty degeneration. Cardiomyocytes are increased in volume and thicken. They have large and hyperchromic nuclei. At the same time, there is an increase of the number of capillaries and agiocrophil fibers in the stroma. In the compensation stage, there are degenerative change, cardiomyocytes, and cardiac interstitial sclerosis. Outcomes of cardiac hypertrophy. If causal factors are eliminated, working hypertrophy is a reversible process. Otherwise, there is cardiac decompensation associated with lack of blood supply to the hypertrophy organs, chronic ischemia. This leads to the disruption of metabolic process, cell degeneration, and necrosis, followed by growth of connective tissue and functional impairment. Next is about vicarious hypertrophy. Vicarious replacement hypertrophy. Replacement hypertrophy, it develops in paired organs due to the death of removal of them, lungs or kidney, or due to the removal of part of the organ, such as liver. The preserved organ or part of the organ takes the function of both. Next, hormonal correlative hypertrophy. Hormonal or correlative hypertrophy is physiological. For example, it is hypertrophy of the breast during lactation or hypertrophy of the uterus during pregnancy. It may be pathological. Pathological hormonal hypertrophy, it occurs as a result of violence of the functions of the endocrine glands. For example, there is acromegaly caused by hypercavity of the anterior pituitary with the excessive production of growth hormone, usually due to the eosinophilic pituitary adenoma. In addition to this type of hypertrophy, there are true and false hypertrophy. True and false. True hypertrophy, it is an increase of the organs or tissue due to the increase of the functionally active tissue, cardiomyocytes, hepatocytes, etc. False hypertrophy, it is an increase of the organs or tissue due to the increase in non-functional tissue, an increase of the kidney due to the hydronephrosis. Note: increasing of the organ or tissue in volume can occur due to an increase in cell size and due to an increase in the number of cells. It should be noted that the increase of cells in size happens due to increasing the amount of intracellular structure. Thus, the macroscopic hypertrophy. It is frequently caused by microscopic manifestation of hyperplasia. Hyperplasia. Hyperplasia is an increase in the size of the organ tissue to the increasing number of its cells. Hyperplasia is observed due to stimulation of meiotic activity of cells, which leads to increase their number. There are reactive, defensive hyperplasia, neurohormonal or hormonal hyperplasia, substitution or compensatory hyperplasia, for example, due to the loss of blood. Reactive protective hyperplasia. It occurs on immune organ stimulus, spleen, lymph nodes, bone marrow, tonsils, intestinal lymphatic apparatus, and others. Myeloid hyperplasia of the bone marrow is most often due to increased needs of neutrophils. Inflammation. Hyperplasia of the lymph nodes mainly happens in response to antigenic stimulation. Spleen in septic condition. Hormonal hyperplasia. It occurs in target organs by the action of hormones. It may be observed both physiological and pathological condition. For example, hyperplasia of the mammary glands during pregnancy and lactation. Examples of hormonal hyperplasia and the pathological condition. Glandular hyperplasia of the endometrium is a result of increased estrogen stimulation of the endometrium, especially during ovulatory menstrual cycles when there is no production of progesterone. The endometrium is thickened, friable, and easily reactive. Endometrium is thickened due to the increased number of glands that have different shapes and size. Some of them may be side-6 expanded. Endometrial glands become Cook-square and convoluted. Granular epithelium has signs of proliferation. In addition, there is proliferation of the stroma, which manifests as an increase in its cellularity. Thyroid hyperplasia. It occurs due to the increased amount of thyroid-stimulating hormone, or due to the action of autoantibodies that are able to bind with receptors for thyroid-stimulating hormone or the membranes of thyroid cells. Euthyroid gout occurs in case of lack of iodine and water, and it may be endemic. The thyroid glands increase in size, often become unweaned due to the pressure of the nodes of various size. Signs of increased activity of the glands include proliferation of the focal epithelium that forms pillows, Sanders pillow, in the lumen of the follicles, papillary outgrowths into the lumen of the follicles. There is signs of lacunar of diffuse responsive of the colloid, appearance of an equivalent of various size in of the periphery. Sometimes there are so many and liquid and color resembles form. And next, it's about prostatic hyperplasia. It often occurs in elderly and it is associated primarily with a reduction in the level of androgen production. It is accompanied by hyperplasia of the glandular tissue and stroma. Increased prostate gland is accompanied by the damaging urine dynamics, urine stagnant, formation of stones, and often leads to a saint infection. Next slide, it's about regeneration. Regeneration is a recovery of the cells, ultrastructure cells or tissue to replace the lost one as a result of the physiological death or as a result of the pathological process. Restoration of the structure can take place at different levels: molecular, submolecular, cellular, tissue or organ, but always it is the restoration of the structure that is able to perform a specialized function. There are two forms of regeneration, cellular and intracellular. Cellular regeneration, it is characterized by the multiplication of cells. It can be observed in the epithelium of the skin, mucous membranes of the gland, gastrointestinal tract, respiratory and urinary system, lymphoid tissue cells and hematopoietic organs, looks connective tissue, organs and tissue represented by the label cells. Intracellular regeneration. It is characterized by the hyperplasia and hypertrophy of ultrastructures. It occurs in all cells and prevails under normal condition in stable cells. For CNS, myocardium, skeletal muscle, such regeneration is only possible form. Thus, the development of some form of regeneration depends primarily on the regenerative ability of the cells, which are divided into labile cells. Labile cells such as basal epithelial cells are the types of Campbell cells. Hematopoietic stem cells in the bone marrow. These cells usually activity divides throughout the life, being source of the cells to replace the dead one. Mature differentiated cells in this specific tissue cannot be divided. The number is preserved by dividing of the labile stem cells. Damaging of the tissue contains labile parenchymal cells and followed by a rapid degeneration. For example, physiological loss of endometrial during menstruation of endometrial ablation is accompanied by complete degeneration of the basal layer of germinal cells within several days. Sufficient number of labile cells remaining after the issue is a mandatory condition for the regeneration. Relatively stable cells. Relatively stable cells, reversible post-mitotic, the parenchymal cells or glandular organs, liver, pancreas, and mesenchymal cells, fibroblasts and endothelial cells, relatively stable cells usually have a long period of life and are characterized by the low mitotic activity. However, they retain the proliferation ability and being to divide if necessary. Preservation of connective tissue stroma and the presence of a sufficient number of viable tissue is a mandatory condition for the regeneration. Next is permanent cells. Permanent cells neurons in central and peripheral nervous system and myocardial cells. Complete recovery is not possible. Therefore, damage of the organ tissue built of regular cells is always accompanied by the formation of scar. Thus, the loss of permanent cells due to the necrosis leads to disruption of the function of these organs. The regeneration process consists of two phases, proliferation and differentiation phases. Proliferation phase is characterized by the proliferation of young and differentiated cells. Cells division continues for as long as the tissue defect will be restored. Differentiation phase is characterized by the maturation of the young cells. There is structural and functional specialization. There are three types of regeneration: physiological, pathological, and reparative. Reparative may be complete reparative regeneration, may be incomplete reparative regeneration. Physiological. Physiological regeneration can be observed in the tissue, which are characterized by the continuous loss of cells, skin, intestinal mucosa, blood, within the form of regeneration labile system cells and Campbell cells divide, resulting in differentiated cells then replace the lost cells during normal activity. Pathological regeneration. It is a violation of proliferation and differentiation phase leading to excessive or insufficient information of regenerative structure, hyper or hypoaggregation. Examples are decelerate wound healing, chronic sores on the legs as a result of venous congestion, formation of keloid scars, traumatic neuroma, excessive colds formation during factory healing, etc. Reparative. Complete reparative regeneration. Recession, it takes place in the tissues that are formed predominantly by the labile cells. It is a replacement of the damaged tissue with a tissue identical to the lost one. Incomplete reparative regeneration. It is characterized by the replacement of the damaged tissue with non-identical one, or in most cases by the connective tissue. Hypertrophy of the serous tissue structure of parts of the organs can be observed for the restoration of the function. An example of incomplete reparative regeneration is healing of myocardial infarction, leading to the development of myocardial cardiosclerosis. Whitish, thick, irregular shape area with defined body scar can be seen in the wall of the ventricle. There is dense fibrous connective tissue in myocardium with the increased cardiomuscles of periphery nuclei or enlarged of hypercomic. Next, it's about wound healing. Wound healing is a special case of reparative regeneration which has several stages. Removal of nephrotic detritus, one of them. Detritus of dead cells, inflammatory exudate including fibrin and blood. Detritus is released by lysosomal enzymes of neutrophils that migrate into this region, followed by excrete via the lymphatic system. Particles are removed of macrophage via phagocytosis. Proliferation of granulation tissue. Proliferation of granulation tissue is a high vascularized connective tissue. Contain new formed capillaries and connective tissue proliferated Campbell cells. With the removal of necrotic detritus, emerging granulation tissue fills the damaged area. Maturation of granulation tissue. It is characterized by the progressive increase in collagen content, and the cells and blood vessels become smaller. Young scar contains a large number of capillaries and fibroblasts, and moderate amount of collagen. Mature scar consists of massive cluster of collagen with a small number of fibroblasts and substantially free of blood vessels. Contraction and compaction of scar. Contraction and compaction of the scar, it is the final stage of healing. Contraction being the early stage of healing due to the active contraction by myofibroblasts and continuous of the scar maturation. Granulation tissue. Granulation tissue is a connective tissue enriched by the vessel and young connective tissue cells. It is formed during the wound healing or around the necrotic areas with subsequent maturation and scar formation. Grossly granulation tissue is soft and colorful. It looks pink and granular due to the presence of numerous capillaries. Microscopically, there is a set of capillaries surrounded by indifferent connective tissue cells. Proliferating Campbell cells of the connective tissue has high metabolic activity. They connect large nuclei and visible nucleoli, and sometimes visible figure of mitosis can be present. The layer of granulation tissue. Surface leukocytes, necrotic layer of surface loops, layer of vertical vessels, layer of vertically arranged fibroblasts, layer of horizontally arranged fibroblasts, layer of fibrous tissue. There are four main types of wound healing. Direct closure of the epithelium defect. It is the simplest healing, consists of the closure of the superficial epithelium defect by the epithelium cells. Wound healing under a scar. Under a scar, it is case wound healing process starts from closing of the blood or lymph, which forms a scab. Underneath, there is a rapid regeneration of the epidermis, and then scab is separated. Wound healing by primary intention. Primary union. It happens in clean operational wounds with agent and a close of each other. There are small gaps of the epidermis and germs filled with clot by blood that forms a scrub. The underlying dermis becomes filled with clot by blood and healing by scar formation. By the first day, the terminal defect filled with granulation tissue and small amounts of loose connective tissue. Wound healing by secondary intention. Wound healing by secondary intention, processes that contribute to the healing by secondary are the same as for primary intention, but they last longer due to the extensive tissue damage and presence of necrotic tissue, foreign body and infection. The mandatory step in the process of secondary intention is the secondary clean of the wound, followed by the formation for the granulation tissue. Next, it's about bone regeneration. Another special case is the regeneration of bone tissue, regeneration of bone fractures, which can occur in two ways: primary bone fusion and secondary bone fusion. Primary bone fusion, it occurs in a complicated bone fracture when the bone fragments are well matched and fixed and there is no infection. Stage number 1 is an activity of proliferation of osteoblasts with the formation of soft-colored granulation tissue consisting of a large number of newly formed thin-walled vessels of capillary types of large number of dividing cells of the connective tissue. Stage number 2 is a differentiation of cells to bone cells, which produce extracellular matrix and form osteoid. Stage number 3 is a formation of a solid callus due to the calcium deposits in osteoid, which is structurally different from mature bone only by a wrong location of bone hems. Stage number 4 is a newly formed bone tissue that is subscribed to the restriction using osteoclasis and osteoblastis. Bone marrow appears in the medullar canal. There is restoration of vascularization and innervation. Secondary bone fusion. It occurs to the process of excessive diaphyseal fractures, mobility, bone fragments, blood circulation, disorders of bone tissue leading to bone regenerative violation. At the same time, cartilage is formed between its bone fragments, which is eventually replaced by bone tissue. It is called as a primarily osteochondral callus. This type of bone regeneration occurs much more often, and comparison with the primary bone fusion takes much more time. Next slide about organization. Organization is a process of substitution of dead tissue of blood clothed by connective tissue. Areas of necrosis, exudate and thrombotic masses undergo respiration, and at the same time young connective tissue grows. Over time, it turns into a dense fibrosis tissue scar. One of the types of organization is encapsulation. It happens when the resorption of necrotic mass, animal parasites of foreign body, does not occur, and there is dermation of using connective tissue from the surrounding viable tissue with the formation of connective tissue, capsule of varying thickness. The related organization term is sclerosis. Sclerosis is a pathological process associated with the hardening of internal organs, blood vessels, or stroma due to the excessive focal and diffuse growth of dense connective tissue. Next is fibrosis. Fibrosis is a moderate sclerosis without the prominent hardening with the tissue, although the clear separation of this term does not exist. Next, cirrhosis. Cirrhosis separates sclerosis with the deformation and restriction of the organs, liver cirrhosis, cirrhosis of the lung, scar, it's a local sclerosis. Replacing wound defect, it's a necrotic focus. It was about scar. It's all for today. Today we discuss about compensatory and adaptive processes. Pay attention, it is only essential of knowledge about pathology anatomy with Dr. Tatiana Prokova. Have a good day.